Assalamualaikum warahmatullahi wabarakatuh, and a very good day to my beloved lecturer, Madam Mawayuni binti Ibrahim, fellow audiences and friends, and all who are watching. How are you today? Do you feel good? Bad? Or so? My name is Muhammad Farisman bin Ismail. I'm from the program of Bachelor of Civil Engineering with Honours with the code CEC 222. My ID number is 20232264444. I'm from the group EC LC590-4 for the course ELC590 English for oral presentations. The third assessment for the ELC590 course is persuasive speech. My topic for this task is parents should be encouraged to vaccinate their children. One of the reasons why I chose this topic is this topic interests me a lot. This makes me want to learn more about vaccination. After carrying out thorough research on the broad topic provided, I found this particular topic the most intriguing, and it attracted me to both learn more about it and also share my learning with everyone. Another reason is to make a difference about vaccination. I realized how vaccination had a huge impact in our health. This intrigued me to further dwell on the topic, gain a thorough understanding of the same, and present it here so it can reach other people. The picture on the left shows the distribution of vaccines across the globe. The picture on the right side shows the percentage of people who get vaccinated. Most of them completely agree, some say somewhat agree, and others. First things first, do you know what are vaccines? What are they actually are? Think most of you have heard it before and familiar with the term. A vaccine is a biological preparation that provides active acquired immunity to a particular infectious or malignant disease. The safety and effectiveness of vaccine has been widely studied and verified. A vaccine typically contains an agent that resembles a disease-causing microorganism and is often made from weakened or killed forms of the microbe, its toxins, or one of its surface proteins. The agent stimulates the body's immune system to recognize the agent as a threat, destroy it, and recognize further and destroy any of the microorganisms associated with the agent that it may encounter in the future. Vaccines can be prophylactic, which means to prevent or alleviate the effects of a future infection by a natural or wild pathogen, or therapeutic to fight a disease that has already occurred, such as cancer. Some vaccines offer full sterilizing immunity, in which infection is prevented. The administration of vaccines is called vaccination. Vaccination is the most effective method of preventing infectious diseases. The World Health Organization WHO reports that licensed vaccines are currently available for 25 different preventable infections. One of the factors of vaccine hesitancy and less distribution of vaccines is contextual influences. For instance, communication and media environment. Some social medias or others may spread false things about vaccines. For example, if you're vaccinated, you will get the risk of dangers, others, and death. Another factor is religious reasons. One of the most common reasons parents offer for not choosing to vaccinate their children stems from their religious beliefs. With only four states not offering exemptions to families for this reason, it poses a major obstacle to the seeking to increase childhood vaccination rates. In addition, these choices are not the byproduct of ignorance, but rather the intentional and calculated decision related to a strong conviction. We are not in their shoes to feel that. Last but not least, safety concerns. The upper picture shows the bar chart percentage on who are the families that delay and refuse vaccines. The lower picture shows the factors of immunization rates. These data are very worrying because not all want to take vaccines. Next, moving on to why the need for vaccination. One of the reasons to get vaccinated is vaccine-preventable diseases have not gone away. Viruses and bacteria that cause illness and death still exist and can be passed on to those who are unvaccinated and unprotected. While many preventable diseases are no longer common in the US, global travel makes it easy for these diseases to spread. Another reason is vaccines help keep you healthy. The Centers for Disease Control and Prevention (CDC) recommends vaccines throughout your life to help protect against many infections. When you skip vaccines, you are vulnerable to illnesses such as flu, measles, HPV, and hepatitis B, and others. There are some diseases that may lead to cancer. Last but not least, vaccines are as important to your overall health as diet and exercise. Like eating healthy foods and exercising, vaccines play a vital role in keeping you healthy. Vaccines are one of the safest preventive measures available, ladies and gentlemen. So the extent of the problem is clear, and so are its causes. What steps can we take to help bring about a solution? What can we do to handle this kind of serious issue? One of the solutions is measurement of efficacy of vaccines. Identifying and measuring barriers to vaccine acceptance is critical to inform cost-effective strategies to address vaccine hesitancy. Several tools have been developed to measure barrier hesitancy towards childhood vaccination, but fewer address barrier hesitancy towards adolescent vaccination. There are no validated tools specifically available to measure adult vaccine hesitancy. However, However, the 5C scale published in 2018 is psychometrically validated tool that assesses five psychological antecedents of vaccination, which are confidence, complacency, constraints, calculation, and collective responsibility, capturing an individual's attitudinal and behavioral tendencies. Secondly, communication and community engagement. Broad vaccine information campaigns can influence vaccine attitudes in the community, but telecommunication is often required to reach high-risk or vulnerable population. As such, vaccine communication should be evidence-based, context-specific, and culturally appropriate, and tailored to the individual's position on the vaccine hesitancy. Continue. Even small progress is still progress, right? Lastly, remove practical barriers to immunization. The biggest barrier to immunization is access. This is true both for the most vulnerable who lack access to basic healthcare services and in areas where vaccines are available but not convenient for people to get. Key challenges include vaccine stockouts, lack of personal protective equipment, travel restrictions, the distances to health centers, limited opening hours, and inconvenient booking systems. Simple solutions can have a huge impact. For example, making it easier for people to come, book, and travel to appointments, and then having calls. The solutions for this kind of problem. I showed the solutions or satisfaction steps was now. And now I'm going to help you visualize it. What happens if you receive vaccination? Like getting vaccinated, people are protected against serious illness and sometimes death from vaccine-preventable diseases. It also protects against spreading those diseases among family members, friends, colleagues, classmates, and the wider community. Lastly, vaccination is considered one of the most cost-effective public health interventions as it prevents the costs associated with treating and causing for people who become ill. These are the examples of vaccines. Firstly, BCG for tuberculosis disease, HEPV for hepatitis B disease. Other than that, DPT for diphtheria disease, rotavirus for rotavirus disease, and many more. If you want to know more about vaccination, how to get vaccination, and others, please contact the persons involved with vaccination through phone numbers and emails for further information. In retrospect, the impact of vaccines is broad and far-reaching, though not consistently quantifiable, analyzed, or communicated. Traditionally, the perceived benefits of vaccination were to reduce morbidity and mortality from infections, and those remain the drivers for the innovation of new vaccines. In particular, in preparation for outbreaks or against infections that afflict in the most disadvantaged in society. Prevention is better than cure. There remain challenges to delivering vaccines to all children and vulnerable people worldwide, in particular those in communities that are difficult to reach geographically, politically, and culturally. And these challenges can only be overcome with the continued commitment and dedication to this endeavor on an international, national, and individual scale. Parents and family members should be encouraged and motivated to undergo vaccination for the greater good. I guess that's all for my presentation today. I hope it is beneficial and open the doors for everyone to accept vaccination. If you have done your vaccination completely, congratulations to you. You have done it and done the right thing. A big thank you I beg to you for your time and listening. Thank you so much and goodbye.